call for the same cause. But we are glad as Church of Uganda Family TV to be part of the awareness campaign of this particular condition. Join me as we welcome Kushaba, Lawin, with us this particular evening. Lawin, it's a pleasure having you this evening.
Thank you so much.
We are delighted to have you, especially sharing with us your passion.
Yeah, exactly.
Yeah.
Good evening, viewers. My name is Kushaba Lawin, an expert client and the founder of Lymphedema Warriors Association Uganda. Our association is majorly, we are doing more awareness and educating the public about lymphedema. And we're also supporting patients that are affected with lymphedema. Yeah.
Well, that is quite interesting. And you talked about the association. And what prompted you to start this association, if you can start from there?
This association was established in 2022. I'm a victim.
Okay.
Because I got this condition when I was just 19 years of age, and that was my senior six. So we didn't know about lymphedema, and I had tried different doctors, different hospitals here, and they failed to diagnose my condition. So in 2018, I happened to go to India, Hyderabad, where I got the right diagnosis for my condition, and it was the very first time I heard of lymphedema as a word, like lymphedema. So I did get, they just gave me the diagnosis of the condition, but I was not given the proper management to the condition. So in 2019, my leg kept on swelling. 2022, 2021, as I kept researching, joining different groups on social media. That's how I got to know more about managing, like to learn more from other advocates all over the world. And then it's when I decided, you know, I'm not alone. Maybe at first I felt maybe I'm alone. That's how I came out. I had to stand out of the public, like, you know, we are different, and we need people to know that, you know, lymphedema is not just a new word, like we are there. I'm not the only one with lymphedema. So from that time, like, why don't I open up an association? Then I had to register one, so that I'm the voice for other patients out there that are in the dark or behind the curtains that are hiding. Yeah.
And indeed you are. To be sincere, I first heard about this when we first talked.
Yeah.
So immediately we went to Google and tried to find about it. But I think it was all a little complex, because especially in our country here, it is a little complex that there is not much research about it.
Exactly.
Yeah.
It's a tropical neglected condition.
Yeah, exactly.
I know, yeah.
Exactly.
Ministry of Health, I'm very sure they know about it,
yes.
But these are conditions that they neglect. Yeah, that's why it's called a tropical neglected condition. Yeah.
Well, we get into the real thing. What is lymphedema?
Lymphedema, this is a chronic swelling caused by built-up fluids, or what we call lymph, that are stuck within the tissues. They are not moving correctly, or when your lymphatic system has a fault, that could be like a mutation, or it could be also like an obstruction within the lymphatic system. Yeah. Okay. So once it's there, the movement of the fluid is not moving correctly, then a certain body part will increase. Maybe if it's the leg, if it's the arm, if it's the stomach, if it's the neck, or in the face, one happens to get lymphedema, of the face, of the arm, and the legs. Yeah.
So it's not about legs? It's
not only about legs, because, okay, the lymphedema that is really common worldwide is mostly the limbs and the arm, yeah. But it can also affect another part, even the genitals of the, for the men, yeah.
Well, we really need to seriously understand some of this. You know, it being that we are Africans, when such conditions happen to us, and then someone is taken to a medical facility, and maybe the medical facility is not able to diagnose, then people will think it is witchcraft.
Exactly.
That is why we really need...
That was my whole life back. Those were like 5 years ago, should I say like 10 years ago, because those are my, like, this is my 11th year with lymphedema, like 10 years ago, like, you know, that witchcraft part of it, like in Uganda, everyone, like, I personally believe maybe I was bewitched, like, you know, doctors have failed to diagnose your condition, and then they embrace it like bandogaya.
Yeah.
Yeah.
Bandoga. And I think this is how people are dying silently.
Silently, yeah.
Exactly. Like you said, you want to come out and speak for those people who
Yes,
are silently dying.
with life, even when you have lymphedema, as long as you know what it takes for you as a patient, like I'm back to normal. I feel like I'm not sick. I don't consider myself a patient. Like I even don't want to call myself a patient because I feel like I'm now back on set. Like I'm looking good. My legs are getting better. Like yeah, I have to live another life. Like I don't have to keep in grief. Oh, my leg is swollen or what. No, I know what to do. So that's why I'm out, and I need to help other patients that are battling silently. Yeah.
Are there specific types of lymphedema?
Yeah, we have two. There are two types. We have primary lymphedema and secondary lymphedema. Primary can be congenital. That's a lymphedema that it normally comes immediately after birth. These are people that are born with lymphedema right away from their mom's womb. You find a woman has given birth to a baby that is already having a swollen. Those are mutations within the genes, like in your mom's womb. You can happen to come out with lymphedema. When you talk about secondary, because that's the most common type of lymphedema in the world, secondary is what I have, like I got an infection in my groin area. This is the groin area where we have lymph nodes in the area. It's a region of lymph nodes. I got an infection and no one knew about it. Like, you know, in Sanjabav, in our local language, I told my parents that I have like, you have a wound somewhere, and I didn't have a wound. That was already a signal that my lymphatic system is getting issues for 2 weeks. So when I woke up to a swollen foot. That's how my lymphedema started. That's what we call secondary lymphedema. Then there are those that have cancer. Cancer patients tend to get lymphedema after, and that's what they neglect here, because they're going to focus on cancer. All doctors are going to give much focus on cancer, attention, forgetting even these patients are going to end up having a lymphedema, depending on the type of cancer. For example, if there are women that have breast cancers and there is a removal of a lymph node in your breast, the affected breast, and they're like, we have to remove those cancerous lymph nodes. Once they're taken out, they leave the place damaged, so you will see someone's arm swelling. If it's for the leg and it's like the urinary, what we call cervical cancer for women, women are going to, once they remove the cervix and have damaged, or what we call, they remove the lymph nodes, people are going to get cancer. It can also come out of the radiation therapy, chemotherapy, so people are going to get cancer, lymphedema. Then you also have the lymphedema in Kamwenge. That's pondoconiosis. It's also a type of lymphedema.
Why is specific in Kamwenge?
It's because they have volcanic cells that contain some minerals like lithium, silicon that penetrate into the skin, and they damage the lymphatic vessels, causing an obstruction in the lymphatic system. We also have lymphedema of injuries, like maybe you're in a taxi, then maybe you get a cut on your skin. We have, maybe you've been playing football and then you fall down and you break your leg, maybe accidents that come also. One can get lymphedema because your system has been disrupted. So you get an obstruction in the system and it's a blockage. Once there's a blockage, your leg has to swell, or your arm. We also have lymphedema from burn, like something will burn you. Like maybe water will burn you, so you can also get a lymphedema. We also have lymphedema from parasites. That's a mosquito. I think that's an Anopheles mosquito that feeds on those filarial worms. Once it comes and bites you, it beats you, then you happen to get a lymphedema, and that's what we call elephantiasis in our local language, the lymphatic paralysis. That's all under lymphedema.
So meaning elephantiasis is also an...
It's a lymphedema. It's a type of lymphedema. That's why when you go to a hospital, a doctor, a lymphedema surgeon, doctor, therapist, they need to know your history. How did your lymphedema start? Was it after surgeries? Were you born with the lymphedema right away from birth? Like, those are the things they ask. Those are the things they ask. And also, we have another lymphedema that can I think those are the ones.
Okay.
Majorly, yeah. Even cellitis. I know many people advertise those lotions, cellitis, but I think people need to go deep and read about cellitis. That's a bacterial infection that affects the deep layer of the skin, which is the dermis, and people get lymphedema once, you know, that reddish thing that they bring reddish patches on the skin, and it's so common with lymphedema patients. The fact that now your skin is vulnerable, the skin is dry for those that don't take care of their skins.
Yeah.
It really loves lymphedema patients, and it's also life-threatening once you do not treat it. Most patients die because neglect. Like they are neglected in hospitals, they don't know how to take care of their wounds. Once you have a cut, that's why you're supposed to be extra clean, because you will end up having a lymphedema. Once the skin is open, you attract a lot of bacteria. Once they enter into the skin or penetrate into the skin, you can also end up having lymphedema. You're just normal like that. I think people are like, you know, how can we prevent lymphedema? No,
exactly.
Lymphedema can happen to anyone. Just imagine you're walking and you fall down. You could disrupt your system and then you get a lymphedema.
Because I now realize that you might not really have a lot to do about the prevention. But
you can, what we call treatment. Treatment is, first of all, lymphedema has no cure, but it's treatable. Those are management measures like non-surgical and the surgical.
We shall actually get to some of these measures later.
Yeah.
But having talked about the types, I think somehow you talked about the causes where you highlighted the accidents, I mean, and vermin exposure and such things. But are there any other specific causes that, besides the ones you've talked about?
All those are the causes.
Those are the causes.
Yeah,
well,
briefly, all of them.
Briefly, those are the causes. Now, someone would really ask themselves, at what point do I realize that I have lymphedema? Are there specific signs and symptoms that someone can look out for, and then they know? Because initially, this is something we grew up knowing, that when you see someone having maybe a leg swelling, then if it is not tallow, then it is Njovu, which is elephantiasis.
Yeah.
But mostly people think it is a tallow, which is attributed to witchcraft.
Yeah, exactly.
Or innate tallow. And then that is how someone, I think, it gets severe, and then sometimes they even die.
They die, yeah. Even amputating their leg.
Exactly, amputating
they amputate your leg off for nothing. Like, you know, you really need your leg. I much it's really big. You have to manage lymphedema, because the goal is to reduce the size of the leg. Because
those are I think, the two elements you grew up knowing, Njovu and the tallow.
But again, when I come back to Njovu, that's part of lymphedema. All that is lymphedema. That's just the cause of Njovu. In our local language, akasidi kakuluma. It feeds on that filarial worm. Yes. And then you happen to get the lymphedema. But that's because lymphedema is a big terminology. The effects that are the causes are many. Just the causes that bring. Yeah, that's why a doctor will ask you what triggered your lymphedema. You need to know. You need to know your history. Maybe I woke up to a swollen foot, and then the doctor will be like, that's a swollen foot. Where did the pain start from? My groin. I got an infection. That's secondary lymphedema, and that's it. Yeah.
Oh, well, let's talk about the signs and symptoms that someone can look out for, and then they know that maybe what I might be having, because like you said, you went to very many hospitals, and no hospital within here was able to diagnose.
No, doctor. The signs and symptoms where one can know, like, first of all, we have the stages, which are 4. We have the abnormal flow, the accumulation.
Very important.
The abnormal, like
stages.
That is stage 1. It's just.
It is called
abnormal.
Abnormal.
Yeah, that one. You've just started your journey. You feel your legs. You feel that swelling, a bit of it, but it's not so visible. People can't really tell the difference. And then you have what we call the accumulation.
Another stage?
Second, the accumulation of fluids, so okulabika.
For this abnormal stage,
it's mild. It's just mild.
There are times you wake up and you feel your leg is a little heavy.
Exactly.
Heavier than the other. You're just dragging it.
Yes, you're just dragging it.
But there is no increase in size.
There's no increase in size, but you're uncomfortable.
Yeah,
that's the first stage. And then the second one, accumulation of fluids. Now here, you've started, people are seeing, they're noticing a difference. But when you elevate, it resolves a bit with elevation. Once you put your legs up above your heart, now you know that there's a decrease in the morning. I'm going to wake up on and off. Then permanent is the third one. The third one is permanent. Now here, it no longer resolves with putting up your legs, mania, you elevate. You're getting to the fibrosis stage of the hardness of the limb. You have nothing to do. There's not much to do. Compression stockings are not going to help a person who has a permanent stage. That is stage 3, whereby now your limb is hardening, the skin is hardening, it's changing color. Then the elephantiasis, fourth stage. Your limb is deformed. You have a deformed, now it's deformity. Like, there are foldings. This other flesh wants to fall on the other. Like, you have a lot of foldings on the leg. Now you're totally deformed. Those are 4 stages. But all those ones, I think you can hear this. Here we have the signs and symptoms of they are heavy. You can't fit into clothes. It's very hard for you to fit into clothes and your shoes again. That's why you find someone saying, like a lot of, I've spent maybe 10 years, 5 years without wearing shoes. How are you going to be able to wear a shoe when the leg is increasing in size? Then itchiness of the skin, fever and chills in that process, the hardening of the skills of the skin. Now the skills,
well, at that point, let's take a short commercial break. When we return, we are going to continue with some of these other signs and symptoms. Kindly stick with us.
Family TV, enriching lives. Family TV, enriching lives.
Welcome back from that commercial break. We are looking at, we are trying to understand lymphedema. And yeah, before the break, well, we came to realize that anyone can be, I don't want to use the word victim. It sounds a little funny and stigmatizing, but anyone can have lymphedema because we looked at the causes, some of which are unavoidable. For example, even if you're the best driver on our streets of Kampala, you can never avoid an accident. You never know when it will come. And I mean, very many other things. You never know which mosquito bites you this particular night or what. So all of us are prone to having lymphedema. But later we shall talk about the management. And we are glad that at least people have come out to address such issues. I mean, to create awareness, to create hope into the people that, yeah, much as you have this, but it's not the end. There is still hope. You can still do a little more. You can be better. You can do a lot of things no matter the condition. So before the break, we are looking at the conditions, the signs and symptoms. We want to pick it up from there. We were looking at the Bikala Kampa. That is where we broke from.
Yeah, the hardening of the skin.
Yes, the hardening of the skin.
Because remember that the skin is hardening.
Yeah.
That's fibrosis. It is really hard. And also recurring infections. The fact that your skin is really hard and dry, now the rate at increase of the infection is going to increase, because once you get a cut, once you get anything, it's going to that leg is going to get infected. For those that do not know proper management for the wounds, yeah. Also suppressed immunity on that affected area. With lymphedema, there's suppressed immunity for those that have the lymphedema, maybe of the leg, of the arm. When I say, for example, mine is in the right leg, once I have any wound or an infection on my leg, there's suppressed immunity because that area has lymph, which is that fluid that keeps oozing out of the leg. Once you badly manage it, it increases in size, and you're also increasing the infections on the skin. So it takes longer to heal. The fact that it's lymph, that's a fluid that is just within the area, disturbing the leg, the wetness of the leg, that area, it takes longer to heal. Yeah. And most people leave it unbandaged. But once you know the proper management of, you're not supposed to leave out the lymph fluid running out of the leg. What we do, we have to bandage. However much of a wound, we have to dress the wound and bandage so that we apply pressure onto the affected area for it to recover, because we are just trying to fight with the system. There's a fault in your system, there's an obstruction in your system, so you're trying to bring it together, so that you heal and you do not progress. It doesn't progress or become life-threatening in the future. Yeah.
Okay. Now that you talked about that, this accumulation of fluids and what, we look at people who, especially children, who have, is it called hydrocele? Something like that. So they're taken, and then some of those fluids are drained out. Is it the same with lymphedema?
Yeah, lymphedema, when it comes to draining out your lymph, we can do it non-surgical or surgical. And the surgical part of it, not everyone needs to have surgery. Not every patient qualifies for surgery. Yeah. Surgery is only for those that have too much obstruction within the system. So when we talk about non-surgical, like what I'm doing right now, like managing my lymphedema, is through wearing compression therapy. That's wearing your compression stockings. It involves a bandaging of the leg. So once you bandage your leg, you've applied pressure onto your limb. You're trying to push those fluids out of the system through going to the toilet to pee. Yeah, that's how you drain your system. You hydrate even a lot and do exercises. don't forgetting your compression, because compressions is key. Like there's no other treatment. It's compression therapy. There's also massaging. Yeah, that soft massage you can give yourself, or from your lymph therapist, and then you go pee it. If it's surgical still, your doctor is going to your doctor maybe will have a liposuction for those that need the liposuction, whereby they will get maybe fats and maybe also they will drain out the fluid. But of course that fluid is not done. They can't complete the whole fluid in the system. No, you can't. You can't drain everything. That's why at the end of the day you have to go back to your compression bandaging. Like you cannot depend on surgery because not everyone needs it and it's expensive. So meaning how you're going to live your life is you have to wear your compression garments, respect that, and that's it.
Are they not expensive?
Very expensive.
Wow. Well, we shall talk about the challenges later, but how is this diagnosed? For example, if like we say that for the abnormal you start feeling a little signs, but is there a specific diagnosis? Probably you can share with us out of experience what you went through until when you were told that what you have is lymphedema.
Yeah, you can maybe if you're a doctor like me right now, I have doctors that are on board on our Lymphedema Warriors Association, and they are doing good in lymphology right now. We are headed with Professor Auntia in German. He's also working with our association, and we have Dr. Patrick Lukula in Bugema, the director of Bugema Hospital, and we also have Dr. Paul Magara, the head of surgery department, Mulago. They all know that, but the diagnosis, we have the CT scan and the MRI can also tell with doctors, and also the Doppler ultrasound scan, and then maybe should I say I'm the lucky one, I had a lymphedema test in India. It is also used, but I don't think we have it here in Uganda. I've not heard of it here in Uganda, but soon we shall be having it.
Amen, we pray.
Yeah.
You talked about these, but I also realized they are all expensive and not in, for example, the MRI, the CT, they're not in every hospital.
Yeah, they're not in every hospital,
but expensive.
Yeah, I reserve mine at Mengo. I think we have only one here. No, Mengo. I think also other hospitals, Kampala Hospital. Yeah, at least hospitals are now coming that have the MRI. Yeah,
but expensive. We can't roll out that. MRI is expensive.
Yeah, it's very
someone
expensive.
was just done an MRI from hospital A, and they were charged 800.
800. Yeah, it depends on what and the findings of your doctor. It depends. Yeah.
Well, let us talk about the challenges. What are some of the challenges that, especially people with lymphedema?
The biggest challenge it comes with doctors not paying attention to this condition, because once you go to the doctors, they often misdiagnose the condition by not giving you the proper diagnosis. In the end, as you're a patient, you'll dismiss yourself from hospital, because you cannot walk to 5-7 hospitals and doctors fail to tell you, why is your leg swelling? Like, you now would keep asking, why is my leg swelling? You're telling me all my veins are functioning. You're telling me there's no sign of DVT sign. So what next? So once they fail to do that, the knowledge gap between our doctors here, once they fail to know that, you dismiss yourself in hospital. You will go to churches for prayers, and then you will also have the other bit of bandoga, that witchcraft part of it. So in the end, you're frustrated, you're going to hide. Some of us, you're going to go home, hide, like that will stop your social life. Like you don't want to socialize with people. You feel like there's something wrong with my body. Every day it's an increase on my part, maybe on my leg, on my arm, like there's nothing to do about it. Another thing, the risk of infections are increasing, because people that live with lymphedema, because there's no management, your skin is the most important part with lymphedema, like the skincare routine, like it's dry, you don't know what to do with your skin. The skin infections are increasing. So what next is you have to hide away from the public. Fitting into clothes as a lymphedema patient, because every day there's an increase on your leg or your arm. You find it hard to find clothes for you to fit. it affects your physical appearance. You're never happy with your body again. Like, standing in the mirror, this other leg is small, this other leg is big, psychologically, it's not good for all of us, all patients, because you're getting out of shape. You're getting out of shape, and also it's complex and expensive to find the treatment and to buy gametes. They're really expensive, even for us who know what to do right now, because a customized socks I'm putting on, it's around 4.5.
Wow.
Yeah, because it's customized. If it's around 1,000 euros or 800 euros, depending on the class of the sock, because those are the things doctors need to know, like your therapist. It's not me who orders a sock. It was a doctor who had to say, Lawin, you need class 3 to 1 somewhere. Like wearing, imagine 3 classes on one leg. Those are specialists that know what you need. You need bandages. Bandages are really expensive. Not everyone can afford bandages.
Are they not these usual bandages?
No, we don't have them here in Uganda. What we have here is crib bandages, and we don't even own any bandage here, because even the crib bandages come from, I think, they're not ours. Yeah, and crib bandages are not for lymphedema. Yeah, we have what we call the short and long stretch bandages. They're also expensive, and they're in German. The makers, the manufacturers in German, and it's also, when it comes to your family, it's frustrating between your caretakers. Once your family is taking care of you, and they have tried to take you to different hospitals, they have looked for solutions, there's nothing to do. So between you and your caretaker, people are tired, they get fed up of your whole thing, because they don't know what even is happening to you. People won't understand you. We also have abandonment in spouses, like people that are married, or maybe you once married and then you get the condition. Your partner might leave you. Your partner might leave you because you've gotten a condition. They do not know what is happening with your body. They just see a swelling. When it comes to us, the young girls, like you've not yet gotten your partner, someone's going to ask you what happened to your leg, and they'll feel like maybe you're going to push to give them the condition, like, well, how about if we give birth and then my babies happen to get lymphedema? So people will ask you a lot of things with lymphedema, even public, like the public where you go to, like people have to look at you like you're different, unless for those that hide their lymphedema. But up to now, people look at me, people wondering like, maybe what happened to that girl's leg, like, people have to look at you. It's also kind of not okay with other patients, but so far me, I'm a public figure. Like I don't know, like whether you look at my lymphedema, I don't care. Yeah, that's I'm different now. I'm different, and I appreciate my body. Like I've embraced who I am. I've come way far with my lymphedema, and right now I must say I look good. And I'm progressing. My lymphedema is doing good because I know how to manage my lymphedema.
I think that is really very, very important. You say that you know how to manage your lymphedema. There are things you talked about earlier, where you talked about the surgery and the non-surgery.
Yeah.
Of course, you talked about a few management issues, a few management procedures that people can pick out, but you also kept on referring to treatment and treatment and treatment.
Yeah.
Is this treatment accessible in let me say, some of the public hospitals or private hospitals around here, or you have to ship the medication from out?
You have to ship the whole thing from out. Because when you talk about the management, it's just in 4 procedures. That's the CDT, which is the complete decongestive therapy. The first phase is the manual lymphatic drainage massage. So this one is between your patient and the therapist. It's supposed to be intense because it's something new to you. It's supposed to be intense, and you're learning, because at the end of the day, you need these self-management procedures for yourself, like self-management for yourself. Like you can't keep going to hospital all the time. You need to. They need to equip you with all that in your head. Those are the manual lymphatic drainage massage. It's a very soft and soothing massage whereby they target the areas that have lymph nodes around this area, around our armpits, around the groin, at the calf area, at the back here, just below the back, we have lymph nodes. They target there, like they are trying to massage, like to activate your your lymph nodes, they should know that they have something like the fluid is coming. They should be able to help you to, at least for fluid to flow correctly, and then followed by the skin care routine. That's the biggest thing, because most people ignore it, like sisiga vizigo for your lymphedema. You have to have essential oils for your lymphedema or natural oils for your skin, so that you moisturize it. We do not want a dry skin, because we already know once the skin is dry, you're prone to more infections. Then after you've moisturized your skin, we have what we call the multi-layered bandaging. That's the lymphedema multi-layered bandages, the many layers, where we have the skin layer on top, the first skin layer you put after you've moisturized your skin. Then we have what we call the foam paddings. They look like mattress foam. You wrap it all over your leg on the first soak you've put. It's cotton. It's not it shouldn't be any other material. It should be cotton. After you've put your the paddings, the paddings, then you put what we call the bandages. The short, it could be short or long stretch for your leg, and then you're done bandaging. And the fourth one is exercising, and the best exercise for lymphedema is walking, because once you're done bandaging, you've applied enough pressure onto your leg, because you have to apply pressure that is comfortable with you, but right away from where the swelling starts from and where it ends from. If it starts from the toes, and if you also have like swollen toes, there are also toe bandaging. You have to bandage the toes very well. Put pressure at your toes. Bring the pressure upwards. If you have the lymphedema that stops at the maybe thigh length, you have to make sure that your bandage till thigh length, and then you go do your movement. If you have walking sticks, they will enable you to push the lymph, because as you walk, and you walk like for a long distance, you can somewhere to walk like for 3 kilometers, 4, 10, it's up to you, but the more you walk, the more that fluid moves correctly from the foot area back to the upper body. So that's how you get to the toilet, and now you're draining that fluid out through your urine.
Okay. Well, as an activist, are there any special arrangements you have to continue creating awareness for the people out there?
Yes. I'm sorry. We have programs now running now that we have a medical camp. We have a medical camp in. We have organized 2 medical camps in September from the 3rd to the 6th. That's Bugema. That's central. It's going to be at the Bugema Hospital. That is central. So we are calling on people from east and maybe north. Those that can come from the north within central. We are going to gather at Bugema. It's a free medical and surgical camp. Then we have that one in west from the 16th of September to the 19th.
Bugema is 6th?
Yes.
Okay.
Bugema is from 3rd to the 6th.
Okay.
Then we have that one in Kamweng. That is covering people from the west. From the west, it's going to be at Rukunyu Hospital from the 16th of September to the 19th, and we are going to have a team of German doctors that are coming. Yeah.
Okay.
And also, we had our first lymphatic surgery in Africa, Uganda this year, though it didn't go public. Yeah, we had 3 operations, one at our Mulago Hospital, our big hospital here, and two were done at Bugema Hospital.
Wow.
Yeah.
Wow.
And the patients are doing good, and the lymphedema is doing good. Yeah.
We need to follow up with such success stories. But still about these medical camps, who should be part of them?
Mainly we need doctors to come through, because we have what we call capacity building, because we need to learn more from the German doctors that are coming. More so the surgical part of it, and non-surgical, which is the conservative therapy the patients need before and after surgery, because you have to do your bandaging sessions before and after, and it's lifetime. Because we also need that knowledge, but mostly that surgical bit of it, because we need surgeries here in Uganda for those that have lymphedema. The fact that the surgeries are really expensive. 2 years ago, I was on social media, I was fundraising for my surgeries to go, and I remember Italy had asked for one surgery that was 345 million Ugandan shillings. That's only one surgery. For USA, I did not mention, but it was almost 1 billion for 3 surgeries that I needed to undergo. But I didn't mention that because it was a big amount. So when I went to Germany, I earned my free surgery, and that's how I had to talk to those doctors, and I had to tell them, you know what, you've helped me, but we are many in Uganda. I think if you can join us, I already registered our association. Come through, teach our doctors, better, because I imagine how many people can go abroad to get that surgery. Not everyone, it's not for everyone. So.
And even if you said we are
even if at the moment,
a car wash, still it might not.
Still, I also had a car wash that was 2022 5th March, and it did come out, so it does not have any help. I also want to thank everyone that contributed, everyone that was there for me during that time. I managed to make it to Germany, and now my legs look pretty good. I'm doing good.
That's interesting and giving hope. Still about this camp, you said that the medical doctors can't come through. What about people who offer palliative care? Because I think they also need the general public. Because at the end of the day, you talked about stigma, and I believe this is now a point. Is it part of your arrangements to take people through palliative care?
We need to take them through, because with stigma, most these are now in Kamwenge, where we had to go and assess those patients, and that was June. I interacted with most of the patients in Kamwenge, and glad enough they were happy to see me, knowing you also have it and you're here with us. We have never gotten someone like you, people that come here just to do the research and all and go. So they were happy to see me, but most of them in Kamwenge, they told us that people stone them, people throw stones at them, and people do not want them to walk past their homes. Where are you going to walk into Kurinya? You know what? Your footsteps, you're going to leave your footsteps behind. Once also our children step where you've just stepped, we are going to get the condition. We cannot get lymphedema from another person, no. That's not how it works. And they are forgetting their volcanic soils, they are around volcanic soils. And they walk barefooted. That's why they have that lymphedema called the pondoconiosis. So the stigma, and I've interacted with other patients, not only in Kamwenge, Kampala, here, and all over the world. Most people stigmatize us. People feel like we are different. How can I sit with you? What if you give me that lymphedema?
Well, as we wind up, I don't know who should be part of the association, but if you don't mind, you can tell people, because someone might be watching us and maybe they have been waiting for maybe someone like you. So probably you can share with them maybe the address of the association as you give us your closing remarks.
By the way, people that have lymphedema, because I think lymphedema is really it's a big term, it's a big term right now, because it's the first time people are hearing of lymphedema.
Exactly.
But all people with venous issues, insufficiency, you come through, because also with venous insufficiency, people do not. It's at times progresses to lymphedema. They need the compression bit of it therapy. It's not just about you going to a shop, we walk into one day pharmacies, and then you're just going to ask for compression garments. I feel like that we should stop that, and doctors should also stop recommending us just go and buy compression stockings. It doesn't work like that, because I've talked to many patients. These stockings do not help them, because most of them complain. Once bocha, they are burning, they're irritating my skin. It's because that's not the right fit. The stockings right now on market, those are travel stockings, like flight stockings. You need to go through that decongestive therapy, which is the CDT, until you reduce your leg. For those that have bigger legs, until you reduce your leg to are normal size for you to get stockings, and this, most times they are customized. They're customized for you. So the cup is going to cater for all those that have vein issues, or you're like you have any might have vein issues, come through. But with bone issues, we don't work on bones. It's mainly the lymphedema, people that have swellings. As long as you have any swelling anywhere, like in men, hydrocele. Let me not forget hydrocele. It's also a part of a lymphedema for their genitals. Yeah, they're also welcome.
Okay.
Yeah.
Well, I asked for the contact for the associations. If someone wants to be part of the association.
Yeah, they can. They can also call on our numbers. We have our website, Lymphedema. Yeah.
Okay, that is I think.
Uganda, and then also they can come through for a medical camp. No one's going to ask for money, by the way. If anyone calls you asking for money, we are not asking for any money. It's a free surgical and medical camp.
Thank you so much, Lawin, and I believe it was really important that you came through. At least you've helped someone there. You've helped a family that was stuck with their child or with a family member. They didn't have a solution, but now they know that one, you're not alone, but also there is hope that if you manage this condition very well, you can be happy again. But also the role of the community and the parents, the family members, to offer especially psychological support to this particular person going through this as a condition. Edrine, Osteen, Mukalaazi is my name. I've worked with Jonan, I've worked with Norman, and very many other people. And from the entire team, thank you so much. Have a good night.